After a year of big, scary numbers flashed before our eyes perpetually, we're finally getting some proper context for them, and that's a long overdue good thing. Those big, scary numbers. A bajillion people have coronavirus. A gazillion people died from coronavirus. Those numbers don't mean very much without a proper basis for comparison. Is a bajillion a lot? Is a bajillion a little? Is a bajillion normal? And if a bajillion people did die of the Rona, but didn't die of other causes they normally would, was 2020 an anomaly for death, or did we just change the lens through which we view death? In other words, with all the mystery around what counted as a coronavirus death in 2020, the only way to get a quality evaluation of these questions is to wait for the total death count on the year. Was 2020 deadlier than usual? If so, coronavirus probably had something to do with that. If not, then there's probably a lot of that miscategorization going on. And secondarily, how did your typical causes of death compare in 2020 to prior years? What happened with heart disease? What happened with cancer, etc.? Well, we're finally getting a glimpse of those numbers. They are preliminary, but at least we have something to work with to evaluate whether the last year actually was the sort of once-in-a-generation threat as advertised, or if it's something that we overreacted to. My own assessment based on the data is kind of both. There were significant excess deaths in 2020, and coronavirus likely has a lot to do with it. But it doesn't have everything to do with it, leaving at least 100,000 plus other excess deaths likely explained not by the virus, but by how we responded to it in radically altering our society. So what are the headline level numbers here? Well, according to CDC data published by the Journal of the American Medical Association and compiled by the New York Times, there were 3.4 million deaths in the U.S. in 2020. That is a significant increase. That's the first year in our country's history over 3 million deaths, and a 16% increase over what would be expected in a normal year with population growth and other factors considered. According to the Times breakdown, 10% of those deaths, or about 340,000, were caused by coronavirus, making it the third biggest killer for the year, behind the usual suspects of heart disease and cancer. Now, a couple of pieces to contextualize those numbers further. Yes, 2020 was a record year for total deaths. It was also a record year for total population. When deaths are shown as a per capita figure, not a raw number, 2020 was a jump over the years immediately prior. That's true, but not actually much higher than other years in a relatively recent time frame. On a per capita basis, deaths in 2020 were right in line where they were in the early 2000s. That's under 20 years ago. But even with the bump properly contextualized, the bump still remains. The bump still needs explaining. Granted, a 16% death swing above expected year to year is not normal. Something odd happened, so what was it? The first and most obvious explainer we're supposed to accept is, of course, the virus itself. The bulk of that jump explained by roughly 340,000 coronavirus deaths. And I have my own skepticism about the strict accuracy of that number, given a few factors. First, an unexplained decline in other major causes of death. Cancer deaths declined just slightly in 2020. That hasn't happened in the prior 5 years of data reported here. Respiratory disease deaths declined significantly in 2020 to a 5-year low. Both of these declines imply to me that some people in very frail condition contracted the virus, and there was probably a coin flip's determination on what caused the death. And we also know that the flu effectively didn't exist in 2020. Flu numbers were the lowest on record, according to a CDC spokeswoman. That record keeping spans 25 years. Now, I'm somewhat confused by how that could be true, but the CDC data in the New York Times report say flu and pneumonia deaths were actually totally normal for 2020. Maybe that's done with reference to the prior flu season, 2019 to 2020, or maybe that means pneumonia spiked and covered the difference with the declining flu. I don't know. Regardless, the sudden disappearance of the flu in 2020, I believe to be an important factor in considering the sudden rise of coronavirus simultaneously. And granted, I'm poking around the edges here. The drop in cancer deaths, the drop in respiratory disease deaths, even if all flu in 2020 was miscategorized, all of these things combined still don't account for 340,000 deaths. So, for this discussion, let's say that 340,000 number is perfectly legitimate. There were 340,000 purely unexpected coronavirus-caused deaths that would not have happened but for the virus. Let's go with that. The other side of the coin is that doesn't explain all of the excess deaths. That's 10% of deaths totally unexpected, but in a year where total deaths were 16% above expected. So, what is that difference? These are the numbers that are massively underreported. Heart disease, the country's #1 killer, up 5%, over 30,000 more deaths in 2020 compared to 2019. Strokes, up 6%, 9,000 more deaths in 2020 compared to 2019. Alzheimer's disease, up 10%, 12,000 more deaths on the year. Diabetes, up 15%, 14,000 more deaths on the year. Unintentional deaths, which include drug overdoses and other deaths of despair, up 11%, 19,000 more deaths on the year. Almost every leading cause of death in this country increased significantly in 2020, and these increases aren't explained by population growth. Our population doesn't grow 5, 6, 15% every year. Yes, we had a biological virus circulating in 2020, but we also had a social one that insisted that government should have massively expanded control of our lives, to shut down our businesses, to close our schools, and in many ways, direct and indirect, to restrict our access to healthy lifestyle options like gyms and health treatment facilities like clinics and hospitals. Oh, well, you can't just claim that. You don't have any evidence to say that. You're just speculating. Okay, fine. If we can't trust ourselves to make reasonable inference that reduced access to our own livelihoods and to healthy lifestyle options and healthy treatment explains these death jumps, you can trust the holy experts on this one too. According to the Journal of the American Medical Association compiling the data, quote, increases in other leading causes, especially heart disease, Alzheimer's disease, and diabetes, may also reflect disruptions in healthcare that hampered early detection and disease management. Increases in unintentional injury deaths in 2020 were largely driven by drug overdose deaths. And here's another point for overdose deaths being closely connected to lockdowns. Per the New York Times earlier this month, quote, the biggest jump in overdose deaths took place in April and May of 2020 when fear and stress were rampant, job losses were multiplying, and the strictest lockdown measures were in effect. Additionally, many treatment programs were closed during that time, and drop-in centers cut back services that in many cases have yet to be fully restored. If you do the math, even if we accept that 340,000 coronavirus death number, total deaths 16% above expected means there are some 130,000 other excess deaths that have nothing to do with coronavirus, the virus, and probably have a lot more to do with coronavirus, the hysteria. We had tens of thousands of deaths flashed before us all year long, but never those tens of thousands of deaths. Why not? And you might say, yeah, well, maybe we inadvertently caused some deaths along the way, but we probably saved way more from potential corona deaths, so it was still wise to be cautious. Was it, though? Did we actually save them? I'm not asking rhetorically. I'm asking genuinely. I would gladly greet the evidence for such a claim. There is absolutely no correlation among states that locked down early and aggressively with lower death rates. In fact, many of the worst lockdown states are also the worst for coronavirus deaths per capita. New York, New Jersey, and others. And there's also no correlation among countries that locked down early and aggressively with lower death rates. Sweden and Brazil were comparatively relaxed, for example, and they aren't outliers globally or in their regions. There is no reason to believe we saved any lives by locking down. There is only reason to believe that we added bodies onto the pile by leading people to live less healthy lives and making it harder for them to get screenings and treatment for other health conditions. And even if we had saved lives, it is clear that we also cost them. So at best, this was a government evaluation of what lives are worth living and how, and what lives are expendable, even if the math works out. Is that really the sort of evaluation that you want the government to be doing? If we can save 100 lives by killing 90 people, should we do it? Or are those numbers actually irrelevant because those 90 people have rights that shall not be infringed? And perhaps each individual ought to be free to forge his own path through difficult times. I don't see any reason to believe that respecting and upholding individual rights to make decisions for themselves would have produced increased deaths. Instead, I see plenty of reason to believe that the supposedly benevolent government hand that was sure to guide us to salvation actually strangled several of us along the way. And several is a kind way to quantify it. More accurately, it strangled at least 100,000 of us along the way. Plausibly, much more. See, it turns out, give me liberty or give me death isn't just a mantra. It isn't just a philosophy about priorities. It's a warning. Death isn't just worth risking for liberty. It's also what you'll pay when you surrender it. Thanks as always for listening and for supporting this channel. Always appreciate that thoughtful discussion down below, and especially over on Gab, that is at ML Christiansen. You're always welcome to coming out and chat in my live streams. Those are linked down in the description. Looking forward to it. Goodbye.